Hi, welcome to ProSport Physiotherapy Halifax. Today we're going to talk about fascia. Okay, so fascia is a word that you might hear thrown around a lot in your assessments. Thought it'd be quite good to explain a little bit more about it so you have a bit more knowledge, okay? So essentially fascia is any connective tissue in your body. And the thing with the fascia is it's actually everywhere, okay? So your bone is essentially a hardened form of connective tissue, so you could argue that that's fascia. You've got it in all of your ligaments, all of your tendons, all of your muscles. It's absolutely everywhere. Not only is it everywhere, it surrounds all your organs and it's in between each individual cell of these, okay? So the best way to think about how your body's made up, I like to use the analogy of Russian dolls, okay? So you've got the first doll, wrapped in another doll, wrapped in another doll, wrapped in another doll, okay? That's essentially how our bodies are made up. So you've got a cell, wrapped in more cells, wrapped in more cells, wrapped in more cells, which then build a muscle, okay? Wrapped in more cells, build a tendon, wrapped in more cells, eventually you get a person, okay? The thing to remember about this is though that between each of those layers, there's something that we would term fascia, okay? So that fascia allows all those layers to slide and move past each other, which is very, very important for good function, okay? When they can't slide and move past each other as well, that's when you can get pain. So if you have an injury, basically there's connective tissue laid down to help repair it, but whereas before the connective tissue may have all been nicely aligned, it gets laid down quite haphazardly, which can then give different symptoms, okay? The interesting thing about the fascia is it actually has its own nervous supply, okay? So pain, you can get pain from fascia. You can have feelings of pressure. So if a muscle feels tight, it's not necessarily the muscle. It could be the fascia itself that's giving that response of tightness, okay? And that's quite interesting when it comes to pain and dysfunction, because when you get an injury, it could be actually damage to the fascia, the surrounding fascial sheath. So for instance, if you roll your ankle, not only have you got damage to that ligament itself, you could also have damage to the fascia around the tendons of the muscles that pass down the side of your ankle. Okay, so it gives us something quite broad to think about. Also, within the fascia, this helps us talk about how we often might find an issue elsewhere in your body linked to where you're finding the pain. So you may have seen in some of our other videos, we talk about fascial slings, okay, and things like that, so how one shoulder can be connected to the opposite leg. This is all to do with the fascia and how that stretches and moves and helps aids our movement, okay? This is why that ankle sprain that you had 10 years ago could now be helping or affecting in some way the shoulder pain that you're getting in the opposite side. I hope this gives you a little bit more understanding of fascia. There's a video also linked to this blog. If you'd like to give that a watch, that could be really helpful. If you have any questions, please don't hesitate to contact us.